Hello everyone, my name is Dr. Ferghal Armstrong and welcome to this episode of Lifestyle Matters, and we have Dr. Saveena with us. Hi Saveena, how are you?
Good, thanks Ferghal, how are you?
I'm very well. So I thought today we'd talk about the benefits of exercise. Now, as you know, they're huge, so we're probably not going to get through very much in one episode, but we'll make a start. So first of all, let's talk about the mental health benefits of exercise. What would you say to that idea?
So I think mental health is a great place to start, Ferghal, given that the whole world is going through a pandemic. In Australia, we're stuck in lockdown most of the year. People's mental health is going downhill. And I think exercise is one saving grace for lots of people. I know it is for me. When you go out for a walk, for example, getting some fresh air and getting some oxygen and it helps to improve your serotonin levels. It helps to improve your endorphin levels, makes you feel better after it. I know I feel that way.
Yeah. So, it also improves brain-derived neurotrophic factors. So that's one of the hormones that is necessary to actually maintain brain development as well. So not only does it produce feel-good hormones, but it also produces substances that support brain neurodevelopment and neural function. I often think of, I love my mnemonic, so I have a mnemonic for the mental health benefits of exercise, and it's DACAS, D-A-C-A-S. So I see the benefits of exercise as helping with depression, anxiety, cognitive dysfunction, Alzheimer's disease, and also sleep. So let's talk a little bit about those in turn. How do you feel that exercise helps with the mood and anxiety disorders, first of all?
Yeah, so as I was alluding to earlier, it helps to increase your serotonin levels. And as we know, serotonin is largely implicated, the deficiency of serotonin levels is largely implicated in the development of anxiety and depression. And also the other aspect of exercise and depression with anxiety is when you exercise, you're also engaging with other people most of the time. You're going out for a walk or you're going for a gym class, you're seeing other people. So social connectivity is also there hand in hand with it. That's my take on it.
And I suppose the other thing is stress is basically unspent adrenaline. We have a fight, flight, or fright response inbuilt into us. And so when we're feeling threatened or anxious, we get all of this adrenaline coursing through our veins. And, back in the days when we were living in caves, that was an appropriate response because we could run away from the saber-toothed tiger. In the modern day, we've got nowhere for that stress to go. So exercise is a great outlet for that adrenaline rush that uses up all of that unspent adrenaline. Moving on to cognitive function, we know that there are a number of factors that are validated for optimal brain health, and exercise is one of them. So we know that regular high intensity and regular aerobic exercise helps cognition. We also, but it's only one factor. So the factors that the Americans actually recommend for brain health include the absence of smoking, appropriate physical exercise, appropriate nutrition, and a glucose less than 5.5 millimoles per liter, and a total cholesterol less than 5.1 or 5.2. So we can see that exercise plays a very important part in brain health as well. And then finally, exercise helps sleep. What would you say to sleep and exercise?
I think that we kind of touched on in our previous episode with when we talked about sleep. Getting that early morning sunlight with our exercise will help to improve our sleep later on. And for some people, having that afternoon, early evening exercise actually helps to improve their sleep quality too. And the other thing is also, as you said, expanding that energy. If you're just leading a sedentary life the whole day on chair for most of the day, you're not actually expending much physical energy, and you wouldn't feel so tired.
Yeah. So it's part of the diurnal regulation, isn't it? It's part of the sleep-wake cycle. You exercise when you should be awake and bright, so that it sets you up for a good night's sleep in the evening.
Definitely.
So moving on to the benefits in terms of musculoskeletal health, what would you say to the benefits of exercise in that context?
I think that's basically lots of people, as we get older, we suffer with lots of arthritis, aches and pains here and there. And many a times, I mean, how many times I would have counted that people would have said, "Oh, I can't exercise because I've got too much pain in my knees or in my back, and I can't do it." And we know that actually exercise will help improve that, but how do we get started? So how would you approach that, Ferghal?
Well, first of all, I reiterate, we know that exercise is a good treatment for chronic musculoskeletal pain. So exercise helps with arthritis. So exercise strengthens the muscles around a joint, which reduces pain. Exercise contributes to weight loss, which reduces pain and which also reduces the stress around the joint. So there are many reasons why exercise helps with pain. But it's not the only treatment modality that we can use in chronic pain. So what we need to do is, first of all, identify what other treatment modalities we can use to help manage pain as we exercise. And secondly, we need to understand that boom or bust actually is a very difficult thing to deal with in terms of pain. So what is boom or bust? So people on a good day will overdo it and then they'll suffer the next day. So they'll boom and then they'll bust. So what we need to do is pacings, and that includes pacing of our activity levels and pacing of our exercise. So broadly speaking, exercise is great for pain, exercise is great for arthritis, exercise is great for strengthening muscles, but it has to be done appropriately, sometimes under medical supervision, avoiding the boom or bust. And it's not the only answer, but it's part of the answer. So because of there are very few musculoskeletal conditions that I can think of where exercise wouldn't be indicated. I mean, maybe myasthenia gravis, you might not want to do it then, but I can't think of anything else where you wouldn't get some benefit from exercise.
Definitely. And I think the other thing to add is, I think the great place to start with exercising is actually doing water exercise.
Exactly. The type of exercise is important.
Yeah. So because, when you're in the pool, when you're in water, you're removing the effects of gravity. So there's less stress on the joints. You can find yourself doing far more than you can do on land. And the other thing is also, it's not so much just swimming or anything. Lots of people say, I don't want to swim. I can't even think about putting on a swimwear and getting into the pool. I have some of my older patients telling me that I can't remember the last time I put on a swimsuit on. And it's a matter of you can just put your shorts on and your shirt on and get into the water, getting up to your shoulder height, getting the water up to your shoulder height, and sort of just doing some exercises. May just be, moving your hamstrings, some breaststrokes, walking, doing some crab walks in the water. It's merely doing simple things like that in the water, which actually helps.
So it's about understanding that you don't wake up and run a marathon. You have to train. And even elderly, frail patients can undergo training. You start off with a low baseline, you identify the target baseline, and you gradually improve over time through the consistent application of supervised training. So it doesn't happen overnight. That's the key thing. It's a gradual process.
Definitely.
Now, what about osteoporosis and brittle bones? How does exercise help with that?
So that's actually, there's a lot of research about that, really. And I think the most convincing theory so far about exercise and osteoporosis is the fact that when you do more strength resistance-based training, it actually helps to increase the cells that produce bone. They're called osteoblast cells. There are some research going about saying, it also reduces the activities of cells that destroy bone called the osteocytes. But the most convincing evidence seems to be coming from from the bone-making cells.
So we know that exercise effectively increases osteoblastic activity and bone remodeling and reduces osteoclastic activity, which is, as you say, those cells that eat away at bone and contribute to osteoporosis. And it's weight-bearing exercise. So we're talking about weight training, push-ups, that kind of thing, walking uphill, that kind of thing, running, aerobic exercise doesn't have the same benefits in terms of bone growth, does it?
No, it doesn't. And you just think about the intensity, the loading of the bone matrix. That's what we're wanting, as opposed to what you do with aerobic exercise. So let's move on to another aspect of how exercise helps with cancer.
It does. I mean, that's the surprising thing, isn't it? Actually getting out and doing your walking the dog, 30 minutes a day, 5 days a week, it actually helps reduce your risk of cancer. Saveena, what do you think about the risks of cancer and how it can be modified by exercise?
So there is a lot, once again, lots of evidence pointing to how exercise can reduce the relative risk of cancer, up to even 30%. And there's most evidence point towards colorectal cancer and breast cancer, actually. And that's pretty astounding, the fact that, exercise can help reduce that risk. Also, if you imagine yourself going through cancer treatment, going through chemo and radiotherapy, you need a good heart and lung function to endure treatment.
Yeah.
This actually helps improve that too.
And of course, it's a very stressful time, and exercise helps deal with stress. So, long gone are the days when you had the diagnosis of cancer and then you were ushered to the bath chair and the blanket was placed lovingly over your knees, thermometer was stuck in your mouth, and you were walked around forever and a day whilst you were going through that. That's just not true. We are encouraging activity as much as possible at all stages of treatment. Yeah,
definitely. And also, the other thing I would like to add about that is there's also, where you were talking about it's a stressful time. When you're stressed, we tend to eat poorer, and we increase our risk of developing other chronic diseases. So if you exercise, you can hopefully help reduce that risk a little bit too. Just improves your mental state also.
It does. So again, what we're seeing is that whilst we're trying to identify the impact of one element of lifestyle medicine on one set of disease risks, actually, it's the benefits of even one element of lifestyle medicine, such as exercise, permeate through so many different aspects of our health and well-being, doesn't it?
Definitely, yeah. And so it's so important.
So thank you, Saveena. I think we've run out of time today, but what I think we should do for the next episode is talk about how exercise can help with our vascular and metabolic health. We'll see you soon.
Looking forward to it, Ferghal.
My name's Dr. Ferghal Armstrong. This has been Lifestyle Matters. We'll see you soon.